my name is Ruchi Bhatia, and this is my case report and fictional diagnosis. Description. So the film I chose was Crazy Rich Asians, and the character I chose was Rachel Chu. Rachel Chu is a Chinese American who works at New York University as an economics professor. She was raised by a single mother and has a boyfriend named Nick Young. I would like to also mention that since she was raised by a single mother, that had prevented her from experiencing the customs of an ideal Asian household in comparison to her boyfriend Nick Young, who grew up in a very wealthy environment with a very strong, tight-knit Asian family that had many connections and businesses throughout Asia, and specifically Singapore. The film is set in Singapore, where Nick Young's family lives. This environment displays strong values of traditional East Asian culture, as Nick's family holds a high regard to wealth and social hierarchy within their society. The overall setting of the film differs from Rachel Chu's upbringing, as she grew up in a lower class environment that did not hold a focus on many Asian customs. And since Rachel grew up to be a very individualistic person and just raised in a very individualistic manner, when she was finally invited to Nick's best friend's wedding, there she had met his family, and that was just the root to her feelings of self-doubt. Diagnosis. So I diagnosed Rachel with social anxiety disorder. This is a mental health disorder that involves a constant fear of being criticized or judged in social settings. So the most common stigma around social anxiety disorder is that people tend to label it as solely just exaggerated stress. Due to this stigma, many people who face anxiety are often left dismissed and often deal with their struggles in silence. And since this stigma leads to mass amounts of misunderstanding, individuals are left frustrated and helpless, and this also deems individuals throughout society who struggle with anxiety as weak or sensitive. Social anxiety, I believe, is diagnosed throughout many cultures. However, I think it just differs in how it is manifested due to differing cultural values. For example, in many parts of Asia, individuals have the constant fear of disrupting family reputation and don't think from a very personal perspective when in a social setting. They're more of thinking of the entirety of their family image and just reputation as a whole. However, on the other hand, in American culture, we think from a more individualistic sort of mindset, and anxiety is mainly built from constant concern of judgment, embarrassment from personal performance, rather than what individuals may think of your entire family or your entire society. Evidence. As described in DSM, the major symptom that Rachel showcases is intense fear of social judgment. An example of this symptom in the film is when Nick introduced Rachel to his family. Prior to this interaction, Rachel attempted to get out of the situation altogether and just found numerous excuses to get out of it. Additionally, she even confided in her best friend to find a way out of the situation. However, it just ended up leading to her bringing her best friend to the family event so she wouldn't have to face her fears of meeting his family alone. Research also explains that such behavior that Rachel displayed, such as social withdrawal and emotional distress, is found in almost 90% of diagnosed cases of social anxiety disorder. A symptom listed in DSM that Rachel did not display is panic-like symptoms such as severe panic attacks. Research has also shown that around 40% of individuals with social anxiety disorder face panic-like symptoms such as panic attacks, sweating, shaking, and trembling hands. With these physical-like symptoms and panic-like symptoms, this increases an individual's heart rate, which I believe is more clinical to the point of hospitalization compared to Rachel's very mild symptoms, where she can still function socially and maintain relationships, and it just makes her anxiety appear more situational and manageable in this sense. Treatment. So the treatment that I would give Rachel is cognitive behavioral therapy, also known as the gold standard treatment. This helps individuals come to terms with thoughts that are triggering their anxiety while also building their overall personal confidence and allowing them to feel comfortable in social settings through exposure therapy. I believe this is appropriate, as Rachel will be able to identify her recurring ideas of being judged for her upbringing and become used to situations such as meeting Nick's family that triggered these thoughts. This treatment would also be appropriate, as research has found that CBT, in comparison to many medications used to combat anxiety, leads to an immense reduction of symptoms and lessens overall relapse within a patient. I can see on the left chart, the CBT therapy and medication have a very equal amount of effectiveness. However, CBT therapy overtakes it by a small margin due to the fact that it doesn't have withdrawal-like consequences if she were to stop going to therapy. It has a more effective impact in the long run. Cultural and situational barriers that may prevent Rachel from receiving the help that she needs. It's the fact that she was brought up in American culture and she has the constant fear of what Nick's family and Singapore may think of her anxiety. In many Asian cultures, anxiety is shunned upon and not very normalized within the community. And additionally, they try to maintain a strong reputation among society and avoid displaying such weaknesses, which unfortunately anxiety would fall under. And I believe it would just make this very hard for Rachel to bring her issue to light, and she would just be forced to downplay it for the sake of Nick's family and for the sake of their image. So from a broader perspective, I think the film does include a very accurate portrayal of social anxiety disorder because of the wide amount of stigma that surrounds it. Since such anxiety disorders are often downplayed and ignored by society, I believe that the film emphasizes this crucial part of it through Rachel's silent struggle with her feelings throughout the film. I also believe that this helps our understanding of how disorders vary person to person. Like I mentioned previously, Rachel's case of social anxiety disorder seems quite mild compared to other cases where individuals may be experiencing both cognitive and panic-like physical symptoms. And it just shows how social anxiety disorder and disorders as a whole looks different for everyone. And these are my references. Thank you.